Ms. Vera Honey.
I'm sorry?
On mute, please, ma'am.
Yes,
Good
ma'am.
morning. And good morning.
And good morning.
All right, Miss Victoria. I have a question for you and good morning.
Good morning.
So I need to make you a co-host. Do I go to share screen and add you?
No, you just go to my name under you can hit those little blue dots on the side and go to my name.
Under participant?
I'm not gonna have a slideshow today though. I mean,
That's okay.
Okay.
No, I don't, I don't care about slideshows. We're good. You know that already. All right. And one other thing, I have another call that I need to be on at noon. So as the co-host, you're going to end up having the rest of the meeting, if you don't mind. Got me? You're shaking your head. I don't know if that's yes, no, what. But anyway.
Yep, understand completely.
All right. Thank you so much.
You're welcome. Thank you.
All right. Hello, everyone. Hello.
Hello.
Hey, Mary Lou. How you been? Haven't seen you here for a minute. I'm Myra.
Hey.
My
Hey,
Linda.
everybody.
Hi.
Hello.
Amanda. How y'all doing? Kelly, I see you're here.
Good morning.
Welcome
We're
back.
back.
Good morning. And good morning. Iman.
Good morning, Miss Kay.
I see some of our new members are here. And I'm going to say hello to all of you guys. Michael is here. Okay. I'm just throwing out names, you know. I'm not going to really throw out everybody's name. All I'm going to tell you guys is that I'm glad that you're here. Maybe a little bit too many of you for us to go around and do an introduction this morning. I hope you guys enjoyed your holiday. I hope you're going to enjoy your upcoming weekend. But even if you have to work, hey, it's okay. Take a break in there somewhere. It's fine. Hi, Ashley. So,
Hi. Nice to see y'all.
So today, really, you know that the state legislation is in session. It's a short session. I think it ends in April, if I'm not mistaken, and I might be a little bit mistaken, but I don't know. But it is a short session, and so Victoria Williams, who's with now, Victoria, you with Birthmark Doers, right?
I am.
Okay, I didn't want to come out and say the wrong thing, right?
Okay.
Ends in June, Ashley says. But still, thanks, Ashley, still short, right? So this week is Black Maternal Week. And of course, Victoria was listening in and she wasn't at the state. She was there. That's important for them, the maternal, for all of us, but that's what they do. So she's going to give just a little bit of what went on with that. The other thing for today is Ashley's suggestion really was to sort of break you guys off into breakout rooms and put people who are within the regions, put all y'all together. Let's say we have 3 or 4 people in region 4 here. You'll go into that breakout room. You could discuss exactly where you are, your organization. And up first, introduce yourselves, because you know, everybody don't know you guys. I don't know half the people in New Orleans, right? And we live here, we work here. don't know them. So introduce yourselves, your organization, talk about your job and your duties, and if there's any kind of way anybody within your region can help you. Even if you feel, now let's do this. If you think you need to come out and say, hey, LaShawn, we're doing this, we need more help, not just from the people here that we know, but from others. So, how does that sound to you guys?
I would like to make one suggestion that
Great.
on your name, if you could put your region, and that way it will be easy for us to break you out into breakout rooms. So maybe in the front or in the back. I see a lot of people have a long extension, so maybe you want to put it in the front, just region 1, 2, 3, 4,
Yeah.
all the way to 8.
Thank you. So, okay, Victoria, if you're ready.
Yes, I am. I did decide that I want to share something with you, so like let me share this screen, this slide.
Okay, can you share? Is this something I need to hit from here?
No, I can share now.
All right. Thank you.
As Ms. Catherine stated, I am Victoria Williams, and I work with Birthmark Doula Collective here in New Orleans, Louisiana. And let's see. So I do a lot of things for Birthmark, but one of my new roles is advocacy director. And so as the advocacy director, I've been very instrumental in policy. And one of our policy initiatives is the Mama Plus, the policy agenda. And it's a bill package that was created by 3 organizations, iWest, Institute of Women in Ethnic Studies, MBAC, National Birth Equity Collaborative, Birthmark, and the Amandla Group. And so we got together under the Merck for Mothers grant to kind of do some working groups around policy. But as we began to host the working groups, people were like, well, what are y'all, what do we think? And so then we created a policy agenda and a name for that. So I'm honored today to speak to you about this important initiative, the Mama Plus Health Policy Agenda. This policy agenda was focused on, and it's aimed to address the maternal health emergency and close the maternal health gap for Black birthing people in New Orleans and across the state. It's modeled after the it's modeled after the Black Maternal Health Momnibus Act of 2020. And that is a federal legislation package created to address the national Black maternal health crisis. So the Mama Plus Health Policy Agenda comprises of local and state policies. The recommendations are from state-led initiatives, such as the Maternal Review Committee, and then we address other issues identified by lay people, and we uplift them in titles, which lays out our policy agenda. All right. So it comprises of 7 titles. And as we said, the policy agenda addresses addresses the most impacted health and birth outcomes for Black and brown people, birthing people in Louisiana. The first title addresses social determinants of health and the effect of maternal health outcomes, including economic justice. The second title focuses on diversifying and increasing the perinatal workforce. The third title is aimed to invest in maternal mental health care and substance use disorder treatment for birthing people. The fourth title seeks to improve support for incarcerated birthing persons. The fifth is aimed at improving telehealth and other digital tools to provide maternal health care to underserved areas. And then we focus on increasing payment for group prenatal care. And lastly, addressing abortion access and reproductive rights issues. So this policy agenda is important. It's an important initiative. It's critical to uplift and support the policies that address social determinants of health and invest in maternal health care throughout the state of Louisiana. So what we've done is created an entire list, and from that list of policies, we just kind of keep track of them to see how they're doing and ways that we can help. So one of the things that we're focused on, as I talked about, we use our policy agenda and those titles in order to create actual bills. So we have House Bills 272 right now, which is the doula private insurance coverage. So last year, what allows us to create our policy agendas for each year is the successes and wins from the previous years. So in 2021 and 2022, we were able to create a doula registry board. And so in order to receive reimbursement from the Medicaid industry, they wanted us to legitimize doulas. And so in order to do that, we have to create a board similar to the social work board and the chiropractic board. Any healthcare profession that you have, anything that's face to face with people, you kind of have like this licensing board, which we don't as doulas. We don't have a license. We get a certificate of completion after your training. And so we just try to figure out the best way to not make sure that we don't oppress already people who are marginalized in the system, but we do want to make sure that they get paid for the work that they're doing. And so being able to provide Medicaid coverage for doula care just kind of opens up another lane for people who just can't afford it. Doulas have been deemed as some, mystic kind of elite character, which is not. We serve all people, all social economic statuses, and then even for birthmark, if you don't have the funds to pay, we have sliding scales, we have grants, but that is not always the case when you are an entrepreneur or a single proprietor, right? A person who's in the community that wants to do the work, but you don't know how to build. So we're just trying to create other avenues so that our practitioners, community health workers, perinatal community health workers can get compensated for the work they're doing. So now that we have the Medicaid bill, and a lot of Medicaid providers are implementing doula, the code in order for doulas to be compensated, we now have private insurers that need to move into that lane. So Representative Matt Willard has helped us introduce this private insurer coverage, requiring private insurers to cover doula support. We also have another one around lactation support and lactation providers. So that's Black Maternal Health Week runs from April 11th through the 17th. The theme for this year is Our Bodies Belong to Us, Restoring Black Autonomy and Joy. You can use that hashtag and just kind of see other events that are going on in the city. We have a screening of a movie, we have a screening of a screening. It's called Black Justice in Baton Rouge on Monday at 5 o'clock at the Claiborne Building. We're asking representatives, is geared to our politicians. We're asking our legislative people to show up because this screening is about them. It's for them so that they can provide awareness to what we're trying to do in the Black and brown community for maternal health care. So if you can check out our social media. I can send it out to the LaShawn group as well if people are interested in showing up. So the best way for you to show up for all of us is to call your legislative people, know them, send letters. When we have moments that we need testimony, we ask that if you have clients or patients or people who are willing to provide testimony. That's always helpful. Yeah, so I also have Black Birth Matters T-shirts. So we sell a T-shirt that the funds for that shirt actually provide support, doula care, doula support for people who are unable to pay the full price. So
How much are your shirts?
they're $15 right now. They're 15. I can hold on. And this is our conference and the things that we rally around, which is Black Birth Matters. And so that's our shirt, and it has our logo on the back: Birthmark Doula Collective and New Orleans Breastfeeding Center. I think that's all. I mean, I could talk more about Monday, but
Are there any questions?
any
For
questions?
Victoria? Yeah. No questions, no nothing.
I'm also happy to send out our entire policy agenda. We list a couple of what do you call it, titles that we are monitoring, and then some key ones that we're like thumbs up. This is working for us. Yeah.
Okay.
Catherine, I have a question. I was asking, is there any way for folks in New Orleans to get a copy of the screen that's going to be played at the Claiborne Building on Monday?
No. They've been going around the state of Louisiana. I'm hoping to have a screening in New Orleans soon, but that was specifically for Black Maternal Health Week, and I think they did it also in Shreveport. So it's coming on down. I'll talk to them on Monday about. We've been talking in the works of trying to figure out a day that we can provide screening here in New Orleans.
Just let us know. Yeah. Any other questions? Okay.
But this is what I have on the screen now. I don't know if you can see, but this is our key legislation, and it's lots of bills on here that we, along with the representative that have authored those bills.
Yeah.
And then there are some that we don't really know much about. I mean, we know what they're about, but we just like monitoring them. That is not about good or bad. And then of course we have the ones that this policy agenda is based off 4 organizations, right? And so there may be some things that other organizations do not and cannot support, but because of our mission and what we believe in, these are the things that we are supporting and the things that we are opposing. So we're not asking anyone to support or oppose any. I have to say that because it's politics. This is just our view from our lens of the policymakers who've been instrumental in helping us move our mission as the Mama Plus bill package forward. Yeah, so any questions? Any bills that you see on here that you're like, oh, I don't know what that means? I'm happy to kind of like share what I do know about it. And also you see the numbers on the side, House Bill 376. You're open to like copy those or write them down, or I can send this entire agenda, like what's maternal health disparities, why are we doing what we're doing, why we chose New Orleans specifically. But as we know, when it comes to legislation, it expands throughout the entire state. So you can go to these bills and you can have she'll give you the entire definition and background of the bill and who's arguing it. So
send it. We'll put it out.
awesome.
Any other questions? So if not, Victoria's gonna put you guys in breakout rooms. And about for how long, Victoria?
Well, it looks like we have almost, we're good on time. So I would say
Right.
about 15 minutes. We can roll inside, and then come back out, and people can report out. Zoom is no longer recording. It's been paused. Should I press
Nah, yeah,
a dollar?
Recording in progress.
I stopped it because it was on too early for, so it's back.
Are there specific questions that you want people to address or talk about while they're in their breakout rooms?
Yeah, go ahead. I mean, if you have something other than what I stuck in the agenda, go for it.
Oh,
I
sorry, I didn't see what was in the agenda. Forgive me.
No, that's okay. I think those are the things that you suggested. Was there something else? All right. Randy, and I saw something in the chat. A couple of people have to leave early. That's fine. Thank you for being here.
I should say you can purchase a T-shirt on our website, birthmarkdoula.com. My bad. I will put it in the chat. Sorry, I had that question.
As a board member, I don't want to go to your website. Could I just come get a darn shirt?
You can. You can always call us and
I will do that. So Ashley, put in the chat, and if you guys need to take you should have your agenda, but if not, just go in the chat and take a snapshot, take a picture, take a whatever.
Okay. This is gonna take a few minutes to put everybody in the breakout room, but we can do it.
Okay. While we're waiting, well, no, because some of y'all gonna be going into breakout rooms soon, so.
And if you have a room with random people, I think that's fine. Because everyone that I can't see the chat and put in the breakout room. So.
Oh. So I can tell you what I have if that helps, but I don't know if that's gonna help you.
How many?
I sort of went in and copied it down. Region 5, I'm just starting where I can, right? Has Marlinda, Kathy Egan, Gina Tracy. I don't know if this is helping you to do this way or not.
One second. It says assign automatically or manually. Let's do manually. Okay. Create. Okay. So in room 1, well, we have 8 regions represented, or how many?
Actually 9.
All right. Region 1. Who do we have? I see
We have Brandy. You see her?
Iman, are you in region 1?
Yeah. We have Keely, Lejeune, Angela Chalk. Anybody else in Region 1 that I didn't call out a name?
Okay, right now I just have 3.
Right.
All right, I'm gonna move on, and then
hold
literally
on.
the rooms will read by the numbers. So if you're in region 1, you're in room 1. Region 2, you're in room 2. Okay. All right.
So there's some people who just added something in the chat, right?
Region 2, I have.
You're able to see?
I can see the name. Those who put their region right in their name, like I add.
Yeah, you can see those, okay.
Like if you renamed yourself. I'm just gonna add what I have and then we'll. Okay. I'm gonna broadcast and like I said, if you're in region 1, 2, or 3, just jump in those rooms and you can add yourselves. Can you guys see that? Do you see the breakout rooms?
I was just looking for them and I don't know where they're located.
I don't see him as well.
Should have popped up on your screen. Breakout rooms in progress. You're moving, we're moving.
It's moving slowly, but it's moving.
Now I see my room. Thank you, Victoria. Hello?
Hello, I'm Patricia, but I should be in Region 1. I'm New Orleans rep. But
Yeah,
whichever
I should
way.
I should be in region 1 too, Patricia. I don't know what happened.
Uh-oh.
Yeah, so I guess we're just still just taking.
You can leave the room and go back to the main group. There's a button in the bottom right of my screen that says leave room, and tell her you're in the wrong place if you want to, or stay.
Wait. Yeah. Lisa. Aviance, she moved over with us. Music turn. Hi, everybody.
I'm gonna order something. Thank you, Deb.
Lisa.
So, how many of y'all have I met? I've met Lisa. I've met Gina. Kylie, I don't think I've met you. Nice to meet you. So, let me see. I believe I've met Lisa. I believe I've met Gina. I don't think I've met you, Kylie.
She's new. She's our newest CHW in Beauregard Parish, but I can remember her.
Hot dog. I didn't know that there were so many of us. I'm excited.
Yeah. We're all OPH, LDH,
Right?
and you are at Families Help Families, right?
Correct.
I thought so.
So all 5 of y'all are OPH?
I'm Patricia, and I work for American Healthcare Hospital. I'm a community health educator, and I work regional.
Hi, Detricia. Nice to meet you. Amanda, are you OPH?
Yes, ma'am.
Ah, hot dog. Great. So what are we supposed to be doing?
About what we do.
Okay, introduce ourselves. I'm cheating, right? Our organization. So we sort of did that. Our jobs and duties? Or you think there's more of us coming?
I'll just talk about ours while we're waiting. We do community health ways, which we get referrals. We're in the health units in each parish. We have a community health worker, and we use the clerks hand out a form, which asks them if they need food, anything, help with food, transportation, electricity, mental health, physical health, and we refer them and help them, link them to services, and we do tons of outreach for the health unit as well as for community health weeks.
Cool.
We do a lot, and we also deliver COVID food and supplies. It's winding down, thank goodness, but we did that. What do you do, Melinda?
So basically, we work with people with disabilities. A lot of times it's typical needs, food, finding a doctor, paying the rent. And then a lot of times, or more times, it's specific to disabilities. So it might be special education. It might be long-term services. It might be services so people can remain in their homes. It might be specific types of health care. It just sort of depends on the need that presents itself. People typically don't find us unless they're looking for some kind of help.
We
But
refer people to y'all quite often.
but it's centered around disability in some way. Now we have a broad definition of disability. So disability could be health, cancer, any other kind of health need that you can think of. Disability could be mental health. There's specific resources for people that have mental health. I know I'm talking to the choir, right? And then there's like developmental disabilities. We work with, we call it womb to the tomb. I mean, we have people that come in that know that,
Wow.
that have been told that y'all do that too?
No, I've never heard of womb to the tomb.
Right, okay. We have people that come in that have been told that they're going to have children with Down syndrome, and sometimes they do, and sometimes they don't. And then, years ago, I haven't heard from them in years, which, hurricanes, disasters, yada, yada, yada. But I had a 86-year-old mother and a 56-year-old daughter that I was working with, both of them. Services change as you age. You acquire disabilities that you didn't have as you age.
Of course.
So, all those things.
Will you be I'm sure you'll be at the expo next week.
I use a wheelchair for mobility, and as long as I have somebody planned to be my assistant that day, and as long as nothing comes apart, because how the things don't always work the way I think they're going to work, but as long as nothing comes apart, I will be rolling around.
Well, good. Hopefully we'll see you there.
Yep. And I'll have my daughter Domino with me. I actually have a daughter. She's 34, 35. Don't tell her I don't remember her age. But anyway, she has a developmental disability, and she will be hanging out with me that day too.
I've met her before when I worked at Autism Services.
Yep. Domino knows everybody. People say, "Oh, you're Domino's mom." I'm like, yeah.
That's great.
Yep.
Miss Tricia.
Hi, I'm Patricia again.
I'm
Yes,
just
Patricia.
group. I don't know why. I just want to know.
I'm Patricia. I work for AmeriHealth Caritas of Louisiana. We're one of the 6 Medicaid plans. What I do is I'm a community health educator. I go out into the community and I educate our members on things that they need, with whether they may need a doctor, whether they may need help finding treatment for Hep C, anything that they need. Behavior health is nothing that falls under the radar because I do NICU also. So it's nothing that we don't go out and do. We do events also where we may do a table setup where people can come up and ask us questions. So we pretty much do a little bit of everything for the company. I enjoy what I do every day. I'm out right now doing it, and that's pretty much it. I work in the New Orleans area. I live in the Baton Rouge area, and I drive to the New Orleans area to do that. So, like I said, I do home visits and hospitalization, where I go out to the NICU more in the hospital. We do have a team that goes out to the behavioral health hospital, but I'm not a part of that team. I go out, and if I'm doing like a NICU, if a baby was born under a certain amount of weight, to help mom get signed up for Social Security benefits, to help cover costs for the baby once the baby is discharged from the hospital. Like I said, help fees. We're doing a lot of help fees. And we're also doing like home-based waivers for those who are bed-bound or have caregivers that come in and give them help, just to make sure that they're satisfied. If they need help with finding an eye doctor, if they need help with, they go into the doctor, they don't understand what the doctor is saying, I show up at the doctor's office with them, just to make sure that they understand and asking the questions. We don't understand how many people suffer from white coat syndrome. Once you get there, all those questions that you have, you forgot them. So when you get home and they're saying, okay, what medicine do you need to take? I don't know. What did the doctor say? I don't know. It literally went over them. So sometimes I show up to the doctor, the dentist, wherever they need me to show up at, I'll be there. So that's what I do for American Healthcare side.
Well, you do a lot.
Yes.
That's
So,
wonderful.
Detricia, do you have somebody like you in Southwest Louisiana?
What's Southwest? What you consider? We go by
Lake Charles, Region 5.
Region 5. Yeah.
Yes, we do. We have a community health educator and a community health navigator.
Oh, cool. Maybe someday they can get on these calls too.
I think
Yes.
we met.
They on here.
Yeah, I think we met
Our
ours.
team is on here right now.
Ah,
Yeah, we met ours through another meeting one day, I want to say. Well, not ours, but Region 5's.
We survive. Yeah.
Yeah. Lisa, you
So
anything?
we enjoy it. Thank y'all.
Thank
And
you.
thank everybody for everything that y'all do. What we do together helps make our community a better place. So thanks to everybody for what you do out in the city here.
Yeah, you're right. It takes all of us. Lisa or Kylie, y'all got anything to add? What y'all do?
I just wanted Latricia's co-workers information.
the people from this region.
Right. Yes, ma'am.
It would be. We have a new lady that just started in that area that covers Lake Lafayette to Lake Charles. Her name is Miss Nicole. I don't have her information in hand.
She's on this call though, correct? I mean, she's in the Zoom.
She may be and she may not be. I'm not sure.
Nicole. Okay.
She's a pretty newbie to the team. And we also have y'all ever heard of Mr. Greg Davy?
Yeah, I've heard that name.
Greg Davy, he does it for that area too. He's the community health navigator.
Oh, okay.
Which he does. Our navigating team is the ones who work more so with behavior health.
Gotcha. Oh, okay. Gotcha. It's interesting. Are y'all on grants or are y'all funded permanently?
No grants. We're funded through the state. We're the Medicaid.
Oh, okay. Y'all are the
We're Medicaid.
Gotcha.
Yeah. So we go out and service our members if they having problems or grievances or lack of understanding. We're there to service them.
Okay, I think one of us, our ex-coworker, and now she got a job with Healthy Blue. Her name's Wanda. And it's pretty much, I think, the same thing that you're discussing. If they have more than, like, say, I don't know, 5 emergency room visits, then it...
Yeah, we going out. Yeah,
Okay.
to keep the emergency room. Yeah, that's pretty much what it is. Yeah, to keep them
Pretty
out of
much
the
Yolanda
emergency
did.
room.
Yeah.
Yeah.
Oh,
That's
okay.
us.
So the last question on the list is there any help that anybody needs? So I'm gonna go first on that one. You know, our expo is next week. We were really lucky we haven't had time to advertise, but we got a 32-inch smart TV donated for a door prize. All we've done is put it on Facebook, so it's probably not going to get out very much. But we're looking for families to come to the expo. Our speaker is the new special ed director in Calcasieu Parish. The special ed director that we had for, I don't know, 10 years more, retired, actually ran for the school board. Mr. Harvey is the new guy, and he's our keynote speaker. He's actually our only speaker, by the way. Most of it is about going to the tables at the expo or the booths at the expo. But just like I'm sure the rest of y'all, we always need more families.
Yeah, we've been pushing that for y'all too, and I was in a ISC meeting with Beryl, and she was really pushing it. So, what's in the families we were in there with? So.
Isn't she so good?
Oh gosh, there's nothing that lady does not know.
Oh yeah.
She's real good, yeah. She's awesome.
What
I
else?
think we just need more funding, which they're working on, grants, funding, because ours are grant funded. We started off on a COVID grant, then we went to the CDC, and then we just jumped on another one. And they're trying to just make it sustainable for us to stay here.
Right.
We're not just needed for COVID, we're needed here long term to help the community.
So do y'all have legislation or something going on?
Yeah.
We
Yeah,
have
yeah.
legislation
Something
too.
legislation.
If y'all are members of LeCan, y'all probably got an alert today about funding for families, helping families, and funding for post-secondary outcomes. If y'all have a similar because it's run mostly by people that care, and the Dee Council helps us. But if y'all have a semi system like that about y'all's funding, y'all drop me an email or something and let me know how to sign up to get the emails, because I can't contact legislators on a regular basis about funding for people with developmental disabilities and agencies that serve them. So yeah, I'm interested in that.
I was really pleasantly surprised. I don't know if y'all were on the LDH town hall meeting this morning. And, that's the big wigs. That's the top brass of LDH. And they actually talked a good, maybe 10 minutes about community health workers. Pictures of community health workers at the tables. And so it's like we are being recognized as part of LDH. And that's a big milestone right there.
That's wonderful.
We're getting there.
Yeah. I mean, I had started bumping into y'all probably last year. Yeah. Oh, we're fixing to go back. Hopefully we don't have to talk.
I know. Nice meeting you all. Well,
Nice seeing those of you I know again
And if the
too.
lady that was looking for Miss Nicole's information could maybe private message me her, I could get it to Nicole.
Okay. Will do.
Thank you.
Thank you.
Bye.
Recording in progress.
I got it. Okay.
Was that fun? Did you all learn something new?
That was it. That was actually great. I had been wanting to meet the people that were here from my region. That was really great.
Yeah, I said we should do this every time. I was in Region 7, and I guess Region 7 people, they all knew each other, so they were like, just sharing events, which is still good. Like, even though, just sharing about events and getting to learn more about Region 1.
Yeah, in Region 5, we got to meet our new, I forgot the exact title, but she's a Medicaid navigator, and we did not, she's not our actual Region 5, she's gonna hook us up with her, but we know that they're here and what they do and everything, so that was very good.
Anybody else? Region 6, Region 7, Region 8. Anybody?
For Region 9, it was just the three of us Southeast employees, but we had a chance to discuss some of the events that are coming up. We have a minority health event on April the 29th, and we have a Cinco de Mayo event next month on May the 5th, and then we have a baby shower with Edna on April the 27th, ladies, I think. So we were just kind of discussing a little more, in detail about those events.
Okay, some of this sounds like maybe the next time we won't put you guys together in the same region that you work in, and maybe we'll split you guys up. I mean, Cynthia, that was good that you were able to talk about how you want to move forward for your events. I think that was great.
Yeah, that's. Catherine, while we're waiting, I sent you a private message we have a new staff at Region 5, Kylie Reed, and I sent you her email if you could add her to the LaShawn group.
You sent it in the chat? Or you sent it to my email? Because I don't see anything.
Hey, I'm so sorry. Miss Gina just wanted me to let you know we just lost power at the health unit. I've been on the Zoom on my phone, but she's on the desktop. So she's in the office with me now.
Well, you want Catherine? You want them to send that email to Dana? You could just forward it to the LaShawn group, maybe.
Yeah, just send it to LaShawn.
Okay, thank you.
All right. Region 1.
Someone has their hand raised.
Hi.
Latricia.
Yeah, Norris.
Hey, this is Patricia, and I talked to an expert about what we worked in, and I was saying that I thought it was a great idea. I wasn't in the group that I worked in. I ended up in Group 5, in Region 5, and I worked Region 1. But I was able to hear what goes on in Region 5, some of the wonderful work that they do there. And they also got to hear what I do for AmeriHealth Parasites, and was able to say that, hey, we have somebody that works in Region 5 that they may not know, and we're able to, I told them to send me their information. I give it to my coworker. So it does work the way that it went, because everybody does something different, and you can hear exactly what's going on everywhere else. That way we can connect all over the state.
Right. So, yeah, we're thinking about, for the next time, we're going to put people in different regions, not the same ones that everybody work in. Like, one group, everybody worked for the same organization, but they were able to talk and put some stuff together that they needed to do, and they talked about their upcoming events, so that was a great thing. I see a hand down, or is that me? No. Don't worry, Lisa Baptiste. I was going to say why your hand is up, but it wasn't you.
Yes, ma'am.
Region 1? So nobody wants to talk in Region 1. Let me do this. All of us sort of knew each other. That's Region 1. So we just talked about some of the things that's going on. I think some resources, some stuff Iman is doing with LDH and stuff that's going to be across the state, and you guys will hear more of that. And so, yeah, Region 3. Did we hear from you already?
No, we met some new people. Oh, we just met, I met Shamika for the first time, and she got to hear about community health workers here in Region 3, and we shared some information, so pretty good.
Great, thank you. Did we miss any regions that y'all not saying anything? Region 7.
All right, does anyone have like a share out that you want to do? I know Region 7 talked about an event that is going on, Black Maternal Health event.
Yeah, Region 5, we have a minority health fair in Allen Parish coming up on the 22nd as well.
I know
I
y'all.
know that,
Like
I'm
y'all,
sorry.
I said I know they not shy.
Yeah, they shy evidently. I don't know. We go
No,
back.
they not shy.
But I do know.
Okay,
The
Miss
Louisiana
Catherine?
Reproductive Justice Day is coming up May 1st. And
May
then,
1st.
yeah, so
Can you guys hear me, Victoria?
I can, yeah.
Can you guys hear me?
yes.
Okay, this is Region 7. I'm sorry. I have poor and my phone just won't pick up. But I just wanted to share in Region 7 that we had open house yesterday in Bienville Parish Health Unit, and even though the crowd was very little to none, I got a chance to speak with the mayor of Arcadia, and he and I are going to partner up. I was explaining to him what community health worker was and the things that we do, and he was eager to get with me and help me get into the school system because I've been having a hard time. And he's hosting a health fair in November in Bienville Parish, and he wants to get with me and partner up so we can make that a success.
All right, sounds good. I think Women with a Vision, into the epidemic thing is there today doing something. I think that's where they are. So they're there and they're talking about ending the epidemic. There's a whole program that they have going on today. So yes. A few of us from Region 5 have a suicide safe talk training. Okay, at noon. That sounds great. And yes, you're excused. You know that shyness? Yeah. It happens. Nobody wants to talk. All right. If everybody's finished sharing, Ashley's going to tell you about CHW bill that we hope will pass. So, Ashley.
All right. Hi, everybody. Yeah, just wanted to let everybody know about some of this going on in the legislature right now. I have to be very clear that I'm just reporting facts. I am not advocating. I'm just telling you what's happening. Representative Moore has introduced a bill that is proposing to create a community health worker board that would oversee community health worker training and advise the Department of Health on how to support the community health worker workforce. As many of you know, but for those who may not have heard this recently or just need a refresher, back in 2019, there was a legislative resolution that was passed that created the Louisiana Community Health Worker Workforce Study Committee, which was a large group of folks who were asked to study the community health worker workforce across the state and provide recommendations to the Department of Health about how to support CHWs. Catherine and I were asked to co-lead that committee, so we did. We did surveys, interviews of CHWs and employers throughout the state, and then made a list of recommendations and wrote a whole report that's available online if anybody wants to see it. So we produced that back in 2020. Since then, a lot of the folks that were involved in the study committee have continued to meet to try to advance CHW workforce policy in the state. So, helped collaborate with Medicaid to try to implement the new Medicaid reimbursement for CHWs, all kinds of other stuff. Anyway, so the purpose of this bill would be to create kind of an official board of community health workers and allies, again, to support the CHW workforce. So the bill was pre-filed a couple of weeks ago, and it is going to committee on April 25th, I believe at 9 a.m. It's Tuesday, Baton Rouge. And so Representative Moore has reached out to us to ask about, just a little bit more about community health workers and, just get good advice on how things should look. So we are aware of what's going on. We are providing information that's being requested, and likely will be present at the committee meeting to provide the committee members with more information on what the board could potentially do and just kind of the role of community health workers in case they're not aware, which they likely are not. So that's a quick overview. I am happy to answer any questions that I can. If there are any. Well, again, I can't advocate on behalf of anything, but what I can say is I can share factual information. This factual information that the American Public Health Association recommends that at least half of all members of any sort of overseeing bodies regarding the CHW workforce should be community health workers. The National Association of Community Health Workers also endorses that concept. So basically CHW leadership of CHW workforce. And this bill does specify that there would be at least half CHWs on the committee.
So, Ashley, to your knowledge, is there any semi-structured campaign to write to the committee and or show up at the committee meeting?
I do not know of any such thing. I don't know of any organization that's going on like that. One could do that if they wanted to. What can I say here?
So, maybe to let you provide facts like you do, to my understanding, each committee has a email that you could write to email committee members, of course, but then each committee has a email that you can email to and ask for your letter to be added to the they don't add it to the agenda, but they add it to the testimony, I think is how they say it. And sometimes those sorts of things, to my knowledge, are helpful. If you choose and you're in favor of what's going on.
Yeah, and I will say also the committee meetings are, they're public, right? So anybody can attend and participate. And one can show up and I think if there's time, I'm not sure exactly how it will look, but I think the way it works is that you can, I don't know if this is in the committee meeting specifically or if it moves on to the actual entire legislature, but there's this idea of you can provide testimony kind of on the spot. So you can submit either a green card just to testify in favor, a red card to oppose, or a white card, which is just to provide information only. You're not saying yes or no, either way. But yeah, so all this stuff will be posted on the Louisiana Legislature website. It's open; anybody can go and participate. Again, what's happening on the 25th is a committee meeting where it will be sort of formally introduced and discussed with the committee. Any amendments will be discussed at that point, and then if it's approved at that point, then it will move on. So I'm sure that we could keep everybody updated on the status, and we'll see what happens.
I'm sorry, I missed it. Which committee?
Oh, Health and Welfare Committee. You didn't miss it. I didn't say it.
Thank you.
That's very, very good and important question. Health and Welfare.
about 2 minutes. Just wanted to remind everyone that if you have events coming up, or if you have anything that you would like to share out, please email LaShawn Lishert for our listserv. And it goes out to everyone. Don't forget to recruit other community health workers and get them to become members, paid members preferably. And save the date for our conference, which is September the 8th, first Friday in September 8th, 2023. It will be live, you guys. It will not be virtual. We'll have an in-person, am I right? In-person, right? In-person conference, yes.
We're thinking about both.
Okay. It's difficult. Yeah, I like it. Possibly both hybrid options for our conference. But yeah. Anyone have anything else they want to wrap up on? I'm happy to give you guys 1 minute back to your clock. All right.
Actually, you're giving them 31 minutes back to their whatever, but that's fine. It's okay.
I thought it ended at 12.
I may have missed one person and ends at 12:30, but it's okay. I mean, if nobody else has anything else, yeah, it's fine. So, Victoria has given you 31 minutes back. Well, I'm talking, so it might just be 30 minutes. But take care, and we'll see you guys soon. Yeah. Thanks, Victoria, for your help. I appreciate that.
Welcome. Thank you. Don't forget the Birthmark Doula Collective t-shirt.
I'm going to call you because I'm on.
Okay. I got you.